Hello, I am Vishva. I am second year BPT student. Today I am going to explain about stretching of piriformis in exercise therapy 2. First of all, what is stretching? Stretching is a therapeutic exercise technique used to lengthen the muscle and soft tissues in order to improve flexibility, range of motion, and reduce muscle tightness. A maneuver used to increase the extensibility of soft tissues and improve flexibility by elongating structures that are pathologically shortened. Now, goals of stretching that are increase muscle flexibility, improve joint range of motion, reduce muscle stiffness, prevent contractures, improve posture, decrease muscle tension, improve circulation, reduce risk of injury, and improve functional movements. Types of stretching are static stretching, dynamic stretching, passive stretching, active stretching, ballistic stretching, and PNF stretching. Now coming to the main point, stretching of piriformis muscle. Now introduction to piriformis muscle. The piriformis muscle is a deep muscle located in the gluteal region, mainly in buttock area. It is an important muscle for hip movement and pelvic stability. Anatomy of piriformis muscle. It is originated from anterior surface of sacrum. It is inserted in the lateral trochanter of femur. Now to piriformis and root value is S1, S2. Action of piriformis are external rotation, abduction of thigh when hip is flexed, stabilizes hip joint. Piriformis as a key muscle. The piriformis is often called the key muscle of the gluteal region because it serves as an important anatomical landmark. Many important nerves and blood vessels pass either above or below the piriformis, making it crucial for understanding the anatomy of the gluteal region. The piriformis also plays an important role in external or lateral rotation of the hip when the hip is extended, abduction of the hip when the hip is flexed, stabilization of the femoral head within the acetabular during movement. Now, what is piriformis syndrome? Piriformis syndrome is a neuromuscular condition in which the piriformis muscle irritates, compresses, or entraps the sciatica nerve, causing pain and neurological symptoms. Signs and symptoms of piriformis syndrome: deep buttock pain, pain radiating down the posterior thigh, tingling or numbness in the leg, increased pain during sitting, climbing stairs, squatting, or hip movements, tenderness over the piriformis muscle. Now, what is piriformis tightness? Piriformis muscle can become tight or spastic, causing pain and discomfort. Piriformis tightness occurs when the muscle becomes shortened, stiff, or overactive. Causes of piriformis tightness that are prolonged sitting, poor posture, overuse during sports, trauma to hip or buttock, and muscle imbalance. What happens in piriformis tightness? Effect of tight piriformis are compression of the sciatic nerve, reduced hip internal rotation, altered pelvic mechanics, and increased stress on surrounding muscles. Now, what is piriformis weakness? Piriformis weakness refers to a reduced ability of the piriformis muscle to generate force and perform its normal functions. Causes of piriformis weakness are prolonged inactivity or immobilization, nerve injury affecting to nerve to piriformis, muscle atrophy, and pain-related inhibition. What happens in piriformis weakness? Effect of piriformis weakness are reduced external rotation of strength, poor hip stability, compensatory overactivity of other muscles, and abnormal lower limb biomechanics. Now coming to the main point, passive piriformis stretch. Position of the patient. Patient lies supine with affected ankle placed besides opposite knee. Technique. Therapist pulls affected limb towards clean with hip joint stabilization. Hold 20 to 30 seconds and repeat 3 to 5 times in a day. Now I will do the passive stretch of piriformis. Suppose this is the affected limb of the patient, so I will do in this limb. Bend your knee opposite, besides the opposite limb. Stabilizes the pelvis and gently pull the hip joint towards the plinth like this. Hold for 20 to 30 seconds. Self stretch of piriformis. Position of patient. Patient lies supine with cross-affected leg over opposite knee. Technique. Pull opposite thigh towards chest. Hold 20 to 30 seconds and repeat 3 to 5 times. Now patient is doing self-stretch by themselves. Place this ankle joint on your this knee. And bend your knee and pull it towards the chest. Hold for 20 seconds. Indications of piriformis stretch. Piriformis syndrome, buttock pain, sciatica due to piriformis tightness, reduced hip internal rotation, athletes with hip stiffness, post prolonged sitting stiffness. Contraindication of piriformis stretch: acute muscle tear, recent hip surgery, hip fracture, severe lumbar disc prolapse, acute inflammation, severe osteoporosis, unstable hip joint and malignancy in hip. Precautions of piriformis stretch are: stretch slowly and gently, avoid bouncing movements, stop if sharp, maintain normal breathing, avoid overstretching. Elderly patient require support, avoid excessive force in patients with nerve irritation. Now goals of piriformis stretching: reduce buttock pain, improve hip mobility, reduce sciatic nerve compression, improve gait, improve sitting tolerance, and enhance athletic performance. Thank you.